Hi, my name is Lindsay Hudson. I am a nurse practitioner student at Auburn University, and this is my sutures demonstration video. So we're walking into our patient's room to assess their suture needs. We're going to walk in the room and wash our hands and introduce ourselves to the patient. We're then going to get a little backstory on our patient. We're going to ask them if they have any past medical history and if they are taking any medications and what they're taking it for. We're then going to ask them if they have any allergies to medications, especially if they have any allergies to betadine or iodine, lidocaine or epinephrine, because those are the medications that are going to be used in the suturing process. You're then going to ask what happened to the patient that led them to get the wound that is now requiring sutures. So now that you've gotten your backstory on your patient, you're going to cleanse the wound. You're going to assess the wound first for how large it is, how deep it is, if the patient may need some antibiotic coverage once they leave here, anything like that. You're then going to use either tap water or normal saline to flush out the wound. You are going to look to see if there's any debris at the bottom of the wound, if there's any grass, rocks, dirt, any of that nature, and get all of that cleaned out. Now the patient is cleansed and ready to go for the numbing process. So there are two medications that you can use to numb up your patient. The first being the most typical that you hear of, which is 1% lidocaine. And the 1% lidocaine is just a local anesthetic that can be used. It works very quickly. It wears off very quickly with very minimal side effects. Another medication that you can use is 1% lidocaine with epinephrine in it. You would want to use this on a wound that is bleeding profusely and you just can't get it to stop bleeding. The epinephrine can cause the blood vessels to constrict and slow that bleeding down so that you can get the sutures done with minimal bleeding. The one thing that you cannot use the lidocaine with epinephrine in it is if the wound is on a finger, a toe, a penis, a nose, or an ear, because the epinephrine can cause some necrosis of those tissues, so you just don't want to use epinephrine on those. So we are going to say that this is a wound on the back. Maybe the patient has fallen out of a tree and gotten a abrasion on the back. We've already washed out the wound. We've already gotten all of the dirt and the leaves and everything out of the wound. So now we're ready to numb the patient up. So what we're going to do is we're going to draw up 1% lidocaine. We're not going to use epinephrine lidocaine because it's not bleeding very badly. So you're just going to get 1% lidocaine drawn up in a 3 or 5 cc syringe. And then you're going to attach a subcutaneous needle. And the way that you're going to inject this is you are going to inject the epinephrine with the bevel up, and you're going to go into the subcutaneous tissue and go all the way in. And as you pull the needle out is whenever you're going to slowly inject the epinephrine. A way to know that the epinephrine is actually being injected into the subcutaneous tissue is that that tissue is typically going to turn white and kind of swell up just a little bit. You can do this as many times as you need to ensure that your patient is getting properly numbed so that you can do the sutures. And before you start any sutures, you'd obviously just want to just kind of test the area, make sure that it's nice and numb. So we have injected our 1% lidocaine and we're waiting on the patient to get numb. So now we're going to set up our sterile field. We're going to take off those gloves that we've used, wash our hands again. We're going to don some sterile gloves and create a sterile field, this is our sterile field. And then we're just going to get ready for the suture process. So the things that you can think about are what type of sutures to use and how long to keep them in. So we have an absorbent suture and a non-absorbent suture. The absorbent tissue you would use inside the body, like if the patient just had a C-section and you're using the absorbent sutures so that you don't have to go back into that incision and take those out of the uterus, it's just going to dissolve. For this, since it's on the outside of the body, we're going to use a non-absorbent suture. You then would want to consider where on the body it is. For instance, if you're if you have a scalp laceration, you would use a 4-0 or a 5-0, and you'd remove those sutures within 5 to 8 days. If it's an injury on the face, you'd want to use a 5 or a 6-0 and remove that in 3 to 5 days. If it's on the chest or the abdomen, you would use a 3-0 or a 4-0 and remove that in 7 to 10 days. If it's on the back, like ours is, you would use a 3-0 or a 4-0 and remove those in 12 to 14 days. If you have a laceration on the arm, you would use a 4-0 or a 5-0 and remove those in 8 to 10 days. If you have an injury on the leg and the foot, you would use a 3-0 and a 4-0. If it's on the leg, you would remove those sutures in 8 to 12 days. And if it's an injury on the foot, you would remove those in 10 to 12 days. Another thing to note is that the numbers on the suture, the larger the number, the smaller the needle. So ours is on the back, and we are going to use a non-absorbent nylon 3-0 suture. And we're going to keep these in for 10 to 12 days. So we have washed our hands, the patient's all numbed up and cleaned. We have donned our sterile gloves, and we're ready to get started. The patient does not have a betadine allergy, so we're going to cleanse that area inside of the wound and all the way outside on the skin to kill any bacteria or anything that's on the skin that could cause an infection. So this whole area has been cleansed with betadine, and we are now going to get started with the sutures. So like I said, this is on the back. So we're using a nylon 3-0 non-absorbent suture, and we're going to do our sutures in an interrupted fashion. So the things that you would need to do your sutures is your sutures. You would need your needle drivers. You need a pair of scissors, and then you need your forceps with teeth. And the forceps with teeth, if you need help grabbing onto the skin to help you get control to do the sutures, you would use your forceps then. So the way that we use our needle drivers is we're going to grab with the tip of the needle driver at the back of the suture, and you're going to lock it in place so that you can't drop it. And I just did that backwards. And that's how you're going to hold your suture. So the way that you go in is you're going to start on the outside of the wound. You go down in a 90-degree angle, and you twist your wrist in that motion to kind of pull the needle through to the other side of the skin. So we're going to go, let me adjust this. So you're going to go into the wound. You're going to twist and come out to the other side. And you're going to pull this through and leave yourself about a 1.5-inch tail. So now you have to make your surgeon's knot, and you're going to take your suture and your needle driver, and you're going to twist the suture around the needle driver twice initially. You're going to grab the tail and pull it through to create your surgeon's knot to keep that suture nice and tight and to approximate that skin so that it can heal. To strengthen that knot, you then want to go the opposite direction. So we just went over, so now we're going to go under. We're going to loop it one time, and then we're going to grab onto our tail and pull it through. You're going to do this one more time. So you're going to go over, grab your tail, pull it through, and then you're going to go under, and go under, and that's running away from me. Grab it and pull it through. You're then going to take your scissors, and you're going to cut this excess so that it's not poking your patient and not getting in the way of your other sutures. You're going to cut those at an angle so that they're the same size as well. So that is our first suture, and we're going to continue this 4 more times for a total of 5. So again, you're going to take your needle driver, you're going to grab your needle and clip it into the back like so. And now you're going to go about 10 millimeters away from that first suture. It really also does depend on the wound and how deep it is, and how much pulling the sutures will do. You don't want to do them too close together or too far together, because you do want that skin approximated throughout, but you don't want it so close and so tight that it's going to pull on the skin and cause pain. And also you want to try and reduce any kind of scarring if you can. So again, going to go in at 90 degree angle. You're going to twist your wrist like so and come out through the other end. You're going to pull it through and leave yourself about a 1.5 inch tail. You're going to loop twice. Grab your tail and pull it through. And now you're going to go under 1 time. Grab your tail and pull it through. Go over 1 time. Grab your tail, pull it through. Go under 1 time. Grab your tail that keeps running away and pull it through. Again, take your scissors, cut at an angle. So they're the same length. And you'll notice that both of these sutures, the knot is on the same side. That's important to keep them on the same side, just so that the sutures don't look, for lack of a better word, ugly for the patient. You want them to look as good as you possibly can. So we're going to go in for our third suture. And again, about 10 millimeters or so away, down at a 90 degree angle. Twist the wrist to come through the other side. Pull through until you have about a 1.5 inch tail. And now we're going to create our sutures, our surgeon's knot. Loop it twice. Grab your tail, pull it through and approximate the skin. And go under 1 time. Grab your tail, pull it through. Go over 1 time. Grab your tail and pull it through. And 1 more, under. Grab your tail and pull it through. Okay. I'm going to cut that excess. And go in for suture number 4. About 10 millimeters or so away. 90 degree angle. Twist the wrist to come through to the other side and pull it. Right, over 2. Grab your tail and pull it through. Under once. Grab your tail and pull it through. Over. 1 more time, under. We're going to cut. All right, and now for our 5th suture. Go in at a 90 degree angle. I'm going to do these sutures a little bit closer together because the wound is a little larger here in the middle. 90 degree, twist it up, pull it through, leave yourself a tail, twist 2 times, grab your tail and pull it through, under, over, and under. So those are my 5 stitches. We have a good approximation of the wound. It's closed throughout. There's the sutures. All right, so now you would want to discuss with your patient aftercare with the sutures. You'd want to teach the patient it's important to keep these covered and not get them wet for the first 24 hours. So avoid taking a shower if needed, just for those first 24 hours. After that, it's fine to take a shower. Just teach the patient, don't submerge them while they're in there. So like we said, this is on the back, they're going to stay in about 10 to 12 days. So the patient's going to need to shower for the next 10 to 12 days. Don't go swimming and don't take a bath. You want to teach the patient to keep it nice and clean and as dry as you possibly can. The patient can use something like a Neosporin or a bacitracin if they are concerned about it getting infected. They could use that just prophylactically so that it doesn't get infected or nothing gets inside of the wound. You'd want to also educate the patient on signs and symptoms of infection. So you'd want to teach them if there's any redness or erythema, if it's beginning to become swollen and irritated, or if they notice any pus coming out of it. You want them to come back so that you can take those sutures out, especially if it has pus in it, open it back up and drain it, get a culture of the fluid to send off, and then you'd start them on oral antibiotics. And that's my suture video. Thank you.